Hi, I'm Dr. Yashwant Mane, Director, Atharva Infertility Center, Nasik. Today we'll be discussing the steps of IVF. After thorough counseling and with baseline investigations, when the couple is diagnosed that she is scheduled for IVF, the patient undergoes the following steps. At the beginning, I just like to brief you a normal physiology of the female reproductive system. As all of you are aware, every female produces a single egg on 14th day of a menstrual cycle. That egg ovulates and enters the fallopian tube. When the couple have a sexual intercourse, the sperms are deposited in the vagina and the sperms ascend into the endometrial cavity. From the endometrial cavity, they take the path of the ampullary region of the fallopian tube. It is at this part of the fallopian tube the egg and the sperm meet, and this is where the fertilization occurs. Now, when fertilization occurs, the embryo rapidly multiplies every 24 hours. But the size of the tube is so small that the embryo cannot grow beyond a certain particular point at this part of the fallopian tube. So eventually the embryo migrates into the endometrial cavity and gets implanted into the endometrial cavity. Now, this is a normal reproductive cycle or the reproductive mechanism in a normally non-fertile female. Now, what different steps we do in IVF? Now, in patients of IVF, the female, we call her on the day 2 of a menstrual cycle. We do an ultrasound scan, we assess the uterus, the ovaries, we see the antral follicle count, and depending upon the age, her body mass index, whether she had any previous treatment with IVF at other cycle or at this clinic, we assess the ovarian response to a particular drug and the dose of the stimulation. So on day 2, after assessing these parameters, we tend to stimulate them with gonadotropin injections. The main intention in IVF is to produce 8 to 10 healthy or good quality eggs. Now, how this is achieved? This is achieved through various forms of injections which are available, and we at Atharva Infertility Center, we always use recombinant gonadotropins for follicular stimulation, because these drugs, they are very pure, they don't have batch to batch inconsistency, and they give an excellent response to stimulation. So initially a female is given injections for 5 days, and on day 6 of stimulation we tend to see how the ovaries are responding. We see for the number of follicles and the sizes of the follicle. If the size of the follicle is around about 13 mm on day 6 of stimulation, we add one more injection that is called as antagonist injections. Then again we give injections for another 3 or 4 days, and when the follicle size reaches 17 to 18 mm, that is called as the trigger day. On the day of trigger, we give the morning dose of stimulation of gonadotropins and antagonist, and we usually schedule the trigger at usually 10 p.m. in the night. So 35 hours post trigger injection, the patient is scheduled for ovum pickup procedure. Ovum pickup procedure is a simple daycare procedure where the patient is brought to the operation theatre under short general anesthesia. After cleaning of the vagina, the follicles which are present in the ovary, they are aspirated outside. When the follicles are aspirated, the fluid is passed on to the embryologist, where the embryologist separates the follicular fluid with the cumulus oocyte complex. After the cumulus oocyte complex is separated and washed, they are transferred into fertilization media. After the ovum pickup procedure is done, the follicular fluid is passed on to the embryologist, and the embryologist segregates the follicular fluid, the blood, and the cumulus oocyte complex. After washing the cumulus oocyte complex, they are transferred into different culture media and kept in the incubator. After some time, the embryologist then denudes this cumulus oocyte complex and identifies the oocyte which is present in this complex. Then they grade the oocyte whether it is mature or immature, or whether it is in a germinal vesicle stage. So the mature oocytes, they are separated and they are transferred to a different culture dish. This is called as day 0 in IVF lab. On day 0, the andrologist prepares the semen sample Depending upon the quality of the semen sample, it could be prepared by a simple swim-off method or density gradient method. The eggs are fertilized by ICSI method, and again they are transferred into a different culture media and kept in the incubator. Then these eggs, they are assessed on day 1, day 2, day 3. Usually at Atharva Fertility Center, we have a procedure or a protocol which we transfer the embryos either on day 3 or in some cases we transfer the embryos on day 5 also. Culturing the embryos to day 5 is called as extended culture. On day 5 of the embryo culture, we assess the embryos, see the grading, do the grading of the blastocyst, and depending upon the grading, we have a protocol which we exclusively practice at Atharva Fertility Center, do a all-freeze cycle. All-freeze cycle means usually we don't transfer the embryos in the same cycle. We freeze those good quality embryos and we wait for a month, and when the patient gets their period, in the subsequent cycle we prepare an endometrial cavity, and with endometrium is good, we get these frozen embryos thawed and we transfer 1 or 2 grade 1 blastocysts back into the endometrial cavity. So these are in short the basic steps of an IVF procedure. Post transfer steps, what are the important precautions the patient needs to follow? They need to take regular luteal phase medicines as prescribed by the doctor. They can do day-to-day activities, they can go to office, they can drive, and they can do absolutely normal routine activity. There are some restrictions like lifting heavy weights, doing heavy jobs, and the patients are advised to avoid sexual intercourse. After transferring of the embryos, on day 15 we do a blood test called as beta HCG. When we do beta HCG, then the patient is confirmed that the treatment has been successful or it hasn't been successful. 70% of the cases, the patient conceives in the first attempt. After a positive beta HCG test, the patient is advised to continue the same medicines for another 15 days, and the patient is scheduled for an ultrasound scan. In ultrasound scan, we tend to assess whether it is a single pregnancy or multiple pregnancy. As you had previously said, in some cases we transfer 2 embryos. So theoretical possibility is there that these patients could have multiple pregnancy also. And once the cardiac activity is documented, then the regular treatment is scheduled.